Hi everyone, I'm Dr. Danish Hassnain. Today, we're talking about a condition that can disrupt your daily life, Menier's disease. Let's dive into what it is, how it's diagnosed, treated, and some common misconceptions. What is Menier's disease? Menier's disease is a disorder of the inner ear that affects balance and hearing. It usually causes recurring episodes of vertigo, hearing loss, tinnitus, and a feeling of fullness or pressure in the ear. Symptoms of Menier's disease. Number 1. Vertigo, spinning sensation that can last minutes to hours. Number 2. Hearing loss, usually fluctuating and can become permanent over time. Number 3. Tinnitus, a ringing or buzzing sound in the affected ear. Number 4. Ear fullness, a sensation of fullness or pressure in the ear. Diagnosis. Menier's disease is diagnosed through clinical history, audiometric tests, and sometimes MRI to rule out other causes, as symptoms can overlap with other conditions. Medical tests. Number 1. Audiometry. Number 2. MRI/imaging. Number 3. Blood tests. Treatment includes medications for controlling vertigo, nausea, and other symptoms. Lifestyle changes, low-sodium diet, avoiding caffeine, and stress management. Hearing aids, for managing hearing loss. Physical therapy, to help with balance issues. Surgery or injections, in severe cases. Menier's disease treatment focuses on managing symptoms since there is no cure. The treatment strategies typically include: Number 1. Lifestyle modifications. Dietary changes. A low-sodium diet can effectively decrease fluid retention in the inner ear. Avoiding triggers, caffeine, alcohol, nicotine, and stress may worsen symptoms and should be minimized. Number 2. Medications. Diuretics, to decrease fluid accumulation in the inner ear. Antivertigo agents. Medications like meclizine or diazepam can reduce vertigo severity. Number 3. Therapies. Vestibular rehabilitation therapy, VRT exercises to improve balance and minimize vertigo. Hearing aids, beneficial for those experiencing hearing loss. Cognitive behavioral therapy, CBT, helps manage anxiety or depression. Number 4. Procedural interventions. Injections. Steroid or gentamicin injections directly into the middle ear can help control vertigo. Pressure pulse treatment. Devices like the Menier device deliver pressure pulses to the middle ear, which may relieve vertigo. Number 5. Surgical options. Endolymphatic sac decompression, reduces fluid pressure in the inner ear. Vestibular nerve section, severing the vestibular nerve to reduce vertigo while preserving hearing. Labyrinthectomy, removal of the balance portion of the inner ear, used as a last resort and typically results in complete hearing loss in the affected ear. Common questions and misconceptions. Question 1. Can Menier's disease go away on its own? No, it's a chronic condition. While the frequency and intensity of symptoms can vary, it doesn't completely go away without management. Question 2. Is it safe to get pregnant if you have Menier's disease? Yes, it's generally safe, but it's important to talk to your doctor because hormonal changes can affect symptom severity. Question 3. Will I lose my hearing permanently? It's possible, but not always. Early diagnosis and treatment can help slow down the progression. Question 4. Does Menier's disease always affect both ears? Menier's disease, which typically begins in one ear, can be inherited, with bilateral cases occurring in about 30% of cases over time. Question 5. Can vestibular rehabilitation therapy cure my vertigo? VRT cannot cure vertigo, but it can help the brain compensate for balance issues and reduce the impact of vertigo on daily activities. Question 6. Can I exercise with Menier's disease? Regular exercise can reduce stress and maintain health, but it's crucial to avoid activities that may worsen symptoms or increase the risk of vertigo attacks. Question 7. Is Menier's disease caused by stress? Stress does not cause Menier's disease, but it can trigger or worsen symptoms. Question 8. Is Menier's disease hereditary? The exact cause of this condition is unknown, but it is likely influenced by both genetic and environmental factors. Question 9. Can I fly or travel if I have Menier's disease? Most individuals with Menier's disease can travel, but it's crucial to carry medication, stay hydrated, and prepare for potential attacks, especially during long trips. Misconceptions. Menier's disease is just vertigo. While vertigo is a primary symptom, Menier's disease also involves hearing loss, tinnitus, and oral fullness. Hearing aids won't help with Menier's disease. Hearing aids can effectively manage hearing loss in Menier's, particularly by stabilizing the fluctuating nature of hearing. It's a psychological issue or caused by anxiety. Menier's is a physical disorder affecting the inner ear, causing anxiety and impacting quality of life, but it is not the root cause. Surgery is the only effective treatment. Surgery is a last resort. Many people manage symptoms successfully through medication, diet, and lifestyle modifications. Menier's disease can be life-changing, but with proper treatment and lifestyle adjustments, many can live fulfilling lives. Consult a healthcare professional if struggling. Stay informed and healthy.